Healthcare in poor countries. People in third world countries are suffering needlessly as they lack the resources, wealth, and ability to fight for their basic human rights like healthcare. When you're sick, you're not forced to walk 900 kilometers in raggedy shoes to another town because that is the closest doctor's clinic to your home. You don't have to wait in 40-degree temperatures to get medical attention. You don't have to, but these people don't have a choice. You do, however, have the power to spread awareness and take collective action to help these people get the healthcare services they deserve. We'll be exploring the hardships faced by families in India, Africa, and Cambodia, including a number of preventable diseases they suffer and what action you can take to make a difference. Let's start by taking a closer look at different geographical locations around the globe. First stop, India. India's healthcare is plummeting with their immensely growing population. Not only are their numbers rising in size, but the rate of those living in poverty has reached over 1/2. 75% of doctors only provide service to those with health insurance, leaving 25% labeled pay out-of-pocket patients, who live off 33 rupees a day, which is equivalent to 66 cents in Canada. They have an insufficient number of doctor-to-patient ratio, 1 per 2,000 people. That's 4 lecture halls full of students to 1 doctor. The Indian government spending in public health care is currently one of the lowest in the world. To achieve a ratio of 1 doctor to 1,000 people, India needs 2.7 million more doctors. All their medical program students refuse to work for the poor, only practicing abroad and in private sectors. But what's better than doctors? Providing nutrition, jobs, and better support from the government. Every year, around 10 million people in poorer countries, including Africa, die of illnesses that can be very cheaply prevented or managed. 1 million people die from malaria every single year. Africa alone accounts for a whopping 91% of those deaths. The life expectancy for Africa is roughly 49 years of age, while Canada's is approximately 81. Africans are suffering from diseases that can be easily prevented and cured. Malaria can be avoided by the use of treated bed nets. Basic scheduled vaccinations prevent the passing of viruses, and clean water and sanitation treat diarrhea, but over 1 billion people do not have accessibilities to these conditions. A country that holds one of the highest infant mortality rates in the world. Welcome to Cambodia. Records show that in Cambodia, 1 out of 30 babies dies in the first month, 1 out of 12 in their first year of birth, and 1 out of 10 before age 5. These inclining deaths are an account of easily preventable diseases and hostile living conditions. These rising death rates result in negative health impacts on families, including reduced ability to think and concentrate, poor health conditions in the future, and higher birth rates to compensate for infant mortality. Cheap technology can largely eliminate these illnesses, cutting these staggering death rates into half. So how do we make these technologies available to families in third world countries? It starts with you and your ability to endorse change. You can donate to GiveWell charities. Your contributions have a larger difference than you can imagine. Serve as a donor to effective projects and not-for-profit organizations. Donate your time, donate your money, and donate your skills. Volunteer or build a career based on this issue. Study a degree, then apply your skills to development by working in an intergovernmental organization such as the World Bank or World Health Organizations. Raise awareness by sponsoring a child or a family and educate yourself and others. Be the change you wish to see in the world. You are more privileged than you are grateful. Recognize the injustice that millions of people are suffering, and you possess the power to make a difference in their lives. Poverty, disease, hopelessness. Every human has the right to proper health care. They deserve to see their children grow up and get an education, to live without the fear of dying from a curable disease. They deserve to drink fresh water and eat a wholesome meal. You do, after all.